We're at the St. Rose Hospital San Martin campus right now, and yes, this was a very elaborate drill. And again, it was just a drill. But what we're going to try to do is take the events over the course of 3 or 4 hours and try to crunch them down into about 90 seconds. So you have a rough idea what hospitals and first responders do as they train to contain a contagious disease outbreak. In this case, somebody exhibiting the symptoms of Ebola. The drill begins with this woman in the pink wig entering the ER at Rose de Lima Hospital.
Our expectations as a acute care hospital in the highly infectious disease realm is centered around making sure the staff can recognize those signs and symptoms of those type of disease processes and then act quickly to get those patients isolated.
Doctors have to follow strict protocols from a checklist.
First, we're going to perform hand hygiene.
The patient is also moved away from others and sent into an isolation unit to begin treatment. One of the people in the protective suits is Dr. Donald Bennett, who says the concern with Ebola goes way beyond the patient.
The pressure for a possible Ebola patient is intense. You start thinking more about the patient, how you're going to keep yourself safe, how you're going to keep the staff safe, how you're going to keep the rest of the hospital and the community safe.
By this time, the Henderson Fire Department has also been notified.
Since the ER's already identified this as an extreme potential and deadly virus, they start doing all the notifications to the health district, and they let us get prepared to do an actual treatment and transport of the patient.
The ambulance crew also suits up in protective gear before the pink-haired Ebola actress is put inside and the transport process begins. Minutes later, she arrives at the St. Rose Dominican San Martin campus, which is one of only 3 federally designated frontline assessment centers in the valley for highly contagious disease. These drills take place from time to time. They're pretty low-key. They don't get a lot of publicity, but let's not forget, Las Vegas is an international destination, so it's good to know that first responders and hospitals are staying on top of this kind of potential problem. Reporting live from St. Rose Hospital San Martin campus, Steve Wolford, News 3. Back to you.
Nice to know they think about these things and train for